Assalamualaikum warahmatullahi wabarakatuh, and good morning ladies and gentlemen. Welcome to Symposium 4D of Forensic Medicine track. I am Dr. Razwin Rahimi and I am the chairperson for this symposium. In this session, we have a diverse topic of presentations which include forensic anthropology, toxicology and DNA analysis. And for that, we are going to have three prominent speakers with us. We will have all the presentations complete before moving on to the Q&A session, which means it will be after the final presentation. Okay, let us start with the first speaker this morning, which I am going to introduce you, Dr. Mohamad Azaini bin Ibrahim. Dr. Azaini, as he is fondly known, is a consultant, forensic pathologist and anthropologist. He is the director of the National Institute of Forensic Medicine, Hospital Kuala Lumpur. He has nearly 25 years of experience in the field, and perhaps one of the highlights in his career is his involvement in disaster victim identification, or DVI exercise involving the victims of MH17 aircraft tragedy in Ukraine back in 2014, and for that he received certificates of recognition from the government of Malaysia as well as the Netherlands Forensic Investigation Team. Apart from the daily clinical practice, Dr. Azaini is also a visiting lecturer to 3 public universities in the country. Without further ado, let us invite Dr. Azaini to deliver his talk titled Forensic Anthropology, Challenges and the Way Forward. Thank you.
Assalamualaikum and good morning to all the delegates present here at this Congress. My name is Dr. Mohamad Azaini bin Ibrahim. I'm a forensic pathologist with also more than a passing interest in forensic anthropology. I'm currently the head of the National Institute of Forensic Medicine here in Kuala Lumpur. And firstly, I would like to thank the organizers for inviting me to give a talk this morning. The topic I'll be touching on is forensic anthropology, the way it's practiced here in Malaysia, and the challenges that we have, and hopefully how we hope to overcome it in the future. Before I go into detail of my talk, I'll probably guide you slowly into what I plan to cover in this half an hour session. Probably what's best is for those of you who are uninitiated in what forensic anthropology really is, and then there'll be a short introduction. And then for those of you who are not familiar with the legal system over here in Malaysia, again, I'll be touching a bit on the medical legal system, the death the inquiries into death in this country, and a bit on the cases that I myself have I've been personally involved in. I'm talking about anthropological cases, and then and capping it off, we'll be discussing some of the challenges that we have in this country with regards to examination of human remains, and finally how we hope to overcome these challenges. Now, what is forensic anthropology? Let's start with that. It is the application of the science of physical anthropology or biological anthropology to solve medical legal cases, to solve medical legal issues. Now, as doctors, as forensic anthropologists, we use our knowledge of human osteology, to actually address medical legal issues such as identification of human remains and whether or not there is a trauma or disease to the bones in cases of homicide suspicious cases. Yeah. Now, the forensic anthropologists would assist the police typically in locating graves, and once these graves are located, help the police in excavating the human remains from these graves in order to preserve as much evidence as possible. And then finally, when the remains are brought to the mortuary, that's where the remains are analyzed, yeah, according to specific protocols. Yeah. Now, so what does a forensic anthropologist do? Basically, they try to determine, primarily interest is in trying to determine identification. How does he do that? First of all, setting up a biological profile of the deceased. Yeah, that is to say, sexing, trying to determine the age at death, the ancestral group, and the living stature. These four factors, determinants, might not be available in a single skeleton at any one time. So it depends on what we have, what's available. We try to determine as best as we can this biological profile. Apart from that, it's not just the biological profile. The forensic anthropologist will try to distinguish whether the bones he's dealing with is either human or is it a non-human bone. And that's just as I mentioned just now, whether there is any trauma to the bones or any disease pathology to the bones. And of course, what the police want to know is an estimation of the time since death. Yeah. Now, that is the analysis of human remains is basically the conventional way of how a forensic anthropologist does his work. Now, but they are also involved in identification of the living. Yeah, for instance, in cases of fraud, where some people try to commit fraudulent crimes, for instance, fraudulent claims of insurance by impersonating multiple people. So forensic anthropologists sometimes gets to look at the x-rays and try to determine whether it is the same person claiming fraudulent insurance claims from different insurance companies. Yeah. Also, sometimes in the estimation of age, in cases of whether a rape victim is actually above or below a certain age where it is considered statutory rape. Yeah. So major areas of forensic anthropological work is analysis of human remains and of course also identification of the living. Now, nobody works in a silo. Yeah. Forensic anthropologists are also the same. They have to work together with other disciplines. Yeah. Most commonly with the forensic pathologists, with forensic odontologists, with forensic radiologists. Yeah. Also with forensic archaeologists. Yeah. And other branches. For instance, samples will be sent to a lab. Yeah. They might be sent for toxicology or serology. Yeah. Maggots, yeah, might be sent for entomological analysis. So, like all the disciplines, yeah, forensic anthropologists do work together with other teams. Yeah. Now, more and more we see forensic anthropologists working in areas where there were victims of genocides. Yeah. The former Yugoslavia, for instance, talking about places like Iraq, Syria, even Sudan. Yeah. So there are cases where people have been killed for whatever reason, and forensic anthropologists are tasked to identify these victims of genocide. Yeah, and also mass disasters. Yeah, we're talking about airplane crashes, earthquakes, tsunamis, and things like that. Yeah, so and forensic anthropologists are called more and more to cases like this, to events like this, to help identify the dead. So much so that they have become an integral part of a disaster victim identification team. Yeah. So I am part of the Malaysian DVI team. I've had first-hand experience in identifying the dead uh, uh, in various exercises, which I will touch on later. Yeah. So, but the reason for this talk is that I just wanted to highlight the fact that although this discipline, yeah, forensic anthropology, is well developed in many countries, but is still virtually absent in Malaysia. There are just two of us left, me and a colleague of mine. Two have just recently retired. So there is a need to develop more and more trainees in this particular field to basically provide the service and continue the research into forensic anthropology. Now, a bit on the legal system here in this country. Yeah, I'll be probably just be touching on how a case gets referred to a forensic pathologist and finally gets referred to a forensic anthropologist. Now, the legal system here in this country is based on the English coroner system, where we have a magistrate that will act as a coroner in an inquiry into deaths. Yeah, uh, the police will have the power investigation, and they will practice discretion in order to order a post-mortem examination or not. Yeah, they have the authority to order whether a case needs to be autopsied or not, based on the circumstances of the death. Yeah, and also the law does allow them to certify death in certain cases. Usually, it's natural cases for someone who dies at home, no suspicions of any foul play. Then the police have the authority to certify death in those situations. The public prosecutor has the authority to order a magistrate to hold an inquest. Now, in practice, the autopsy is ordered by the police, by the power invested therein by our country's criminal procedure code. Section 3 to 9 of the said code will say that the police will investigate the death and then will send the body to the nearest government hospital for a postmortem to be done by a government medical officer. Now, what usually happens is that if it's a case of if it's a homicide case or a case that happened in a case that happened in under suspicious circumstances, the case is referred to a forensic pathologist. Yeah, uh, and then if it involves human remains, the forensic pathologist will then refer the case to a forensic anthropologist. Yeah, and the forensic anthropologist will perform an anthropological examination on the remains, and he will produce a report. The police almost never refers directly to the forensic anthropologist. And why is this so? My take on it is that they are unaware of the discipline of forensic anthropology in this country. Like I said, there are just two of us now, and basically it lacks visibility. Some of the reasons I will state later, probably because of the low, very low caseload when it comes to forensic, when it comes to skeletalized human remains. Yeah, so the police are by and large unaware of this discipline. Yeah, the other factor I think where the police would prefer to call a forensic pathologist is the fact that the report by the forensic anthropologist will not state the cause of death. Yeah, the cause of death is still given by the forensic pathologist. So what happens is that the forensic pathologist will produce a primary report, with the report of the forensic anthropologist being addendum or an appendix to that report. Yeah. So after the, for instance, if the report by the forensic anthropologist says there's no injury to the bones, nothing suspicious, only then the forensic pathologist, he will include the cause of death as undetermined or something along those lines. So the report by the forensic anthropologist is supplementary to the report, to the primary report by the forensic pathologist. So these are the key actors in the medical legal death investigation in this country. Yeah, you have three arms of this investigation: the Ministry of Health, the Royal Malaysian Police, and the judiciary. Yeah, post-mortems, autopsies are usually done by medical officers, or in the case of a homicide or suspicious death, by a forensic pathologist. The investigating officer is the Royal Malaysian Police, and which answers to the which is ordered by the judiciary. Yeah. So in a flow chart, this is how it goes. Yeah. The police will receive information regarding a death, whether it's a suicidal death, homicidal, accidental, suspicious, or sudden death. Now, Section 329 of the Criminal Procedure Code will make it compulsory for the police to investigate the scene and the body at the scene, and then if he deems that a forensic pathologist should come to the scene, he will be called. Now, the investigation report will be forwarded to the magistrate. The police has either can certify death, like I mentioned just now. In certain cases, yeah, the police officer has the authority to certify the death, or if he deems that a post-mortem examination is necessary, he will arrange for it to be done at the nearest government hospital. In principle, autopsy is conducted by a medical officer, unless, of course, it's a homicidal or a suspicious death. Then the forensic pathologist will conduct the examination. When that is done, the post-mortem report will be submitted by the police to the magistrate or the public prosecutor. So this is generally how inquiry into death, as far as the order for an autopsy to be done, how it's conducted here in this country. Now, then how is forensic anthropology practiced in Malaysia? Like I said, usually the forensic pathologist will be called first. Yeah. Now, in most cases where skeletal remains are involved, are usually handled by a forensic pathologist, especially if the remains show no outward signs of trauma. The circumstance of death is straightforward. For instance, natural, let's say a skeletal remains is found in the room, locked from the inside, no signs of disturbance in the room. It is the deceased had probably a history of medical problems, so it is assumed that he died of natural death, and there are no outward signs of trauma on the skeleton. And also, if the biological profile, for instance, the sex and the stature, is fairly easy to determine, yeah. And also, again, when the estimation of time since death is not that difficult. So, forensic pathologist, by training, by the knowledge that he or she has, usually they are competent enough to perform a anthropological analysis. Yeah, but again, that means that the applied methods by the pathologist will thus vary. Yeah, for instance, a pathologist might just rely on just one method of determining age at death. For instance, just the cranial suture method. They might not know how to use the Suchi-Brooks method. So it might vary. The methods used by the pathologist might vary in that sense. Yeah. So there are structural and academic limitations that affect the practice of forensic anthropology in Malaysia. That is not to say that we don't have any cases at all. Yeah, some of the cases I was personally involved in. For instance, the Bunting murders in 2010, where a prominent local businesswoman was murdered. Yeah, she together with three others. It practically grabbed the headlines during that year, and the remains were basically fragmented, burned, and charred, small bone pieces. Yeah, uh, that is one case. And then a year later, the remains of a young French tourist, a young French woman, was found in a cave on Tioman Island off the coast of Pahang. Uh, Forensic anthropological analysis was done, and the cause of death was blunt trauma to the head. Yeah, I was not involved in this case. A colleague of mine was. And in 2014, yeah, I'm sure most of you would probably remember this, the MH17 airplane tragedy where a Malaysian passenger plane was shot down in eastern Ukraine. Yeah, 298 people lost their lives on that day. And that was the first time the Malaysian disaster victim identification team was involved in an international DVI exercise. Yeah, I was part of that team. Yeah, so after that, we were involved in a few other DVI exercises in, I believe, in Indonesia shortly after that. Yeah, and then 2016 and 2018, Ops Reunite and Ops Stay Auraki. These were two names given by the, respectively, by the Australian Ministry of Defence and the New Zealand Ministry of Defence. It was a joint cooperative venture between them and our Malaysian armed forces to exhume and repatriate remains of Australian and New Zealand armed forces personnel and their families who lost their lives in the period after the Second World War. It was during the period of the emergency here in our country. I'm talking about the early 1950s. Yeah, so it was opportunity for us to learn how the Australians and the New Zealanders perform archaeological and political work. So the bodies were then repatriated back to their home countries. And then in 2015, yeah, a number of graves, I believe about 100 and close to 140 graves were found along the border, in the jungle along the Malaysian-Thailand border. Yeah, the dead were believed to be victims of a human trafficking operation. We did anthropological analysis on all of the remains, but since they were not identified, we had them buried in a temporary marked grave. Yeah, the temporary controlled burial. Yeah, so that if ever comes a time when a family member does come forward to claim, we can identify correctly where the bodies are buried and exhume those bodies. Now, the question rises is whether is there a need for a well-developed forensic anthropology expertise? The answer to me is a resounding yes, because this region is prone to natural disasters. Yeah, it lies in the famous Pacific Ring of Fire area. It's an active belt where it's a seismically active belt of earthquake epicenters, active volcanoes, touching the countries of the Philippines, Indonesia. Yeah. So example given is the Indian Ocean tsunami in 2004, where I believe close to 250,000 people died. Yeah. Cyclone Nargis, which hit primarily Bangladesh and Myanmar in 2008, again killing I think close to 140,000 people, if I'm not mistaken. And in 2011, yeah, the earthquake in Japan, in Tohoku, Japan, with a resulting tsunami, again killing close probably about 15 or 16,000 people. So these are the natural disasters that we have come to expect living in this area. And then and again, like any other country, non-natural disasters are also can also happen. Yeah, I'm talking about building being collapse, arson, involving a lot of death and so forth. And the threat of terror and extremist attacks, it can happen anytime, anywhere. Yeah, that could result in mass fatalities. And as demonstrated in the case of the Wang Kilian graves, people do migrate, sometimes legally, sometimes illegally, yeah, because of famine, prosecution, human trafficking, etc. The difficulty comes because these people, these victims are from other countries, so identification becomes a bit of a will become problematic. Yeah. Now, what are the challenges that we face in this country? I've mentioned this before. Uh, we do have a low anthropological caseload. Yeah, this is probably a challenge that we probably cannot solve. Yeah, Malaysia being what it is still a close-knit society. People do not go missing for long periods of time. Uh, they are usually found within, within a time frame where anthropological analysis is probably not required. Yeah. For instance, in a center like mine, in the city, we see very few cases of skeletalized remains in a year. Yeah. So we do have a low anthropological caseload. And again, I mentioned earlier that it the field of forensic anthropology does lack visibility. Police are unaware of the discipline, yeah, and they're not familiar with it. So that's why cases do not get referred to a forensic anthropologist from the outset. Now, what is important and that I feel that we need to overcome is that we have almost a non-existent skeletal reference collection. Yeah, the reason being mainly religious. Yeah, of course, cultural. Uh, our society does not really look kindly upon keeping bodies or skeletons for research and studies. Yeah. So we do have a problem. It's not like easy. It's not easy to get people to say, donate your skeleton, donate a body for research purposes. Yeah. So we have problems when it comes to setting up a skeletal collection. Yeah. The collection that we do have are basically just cases where the biological profile cannot be corroborated. Yeah, forensic anthropological analysis has been done, but the ID cannot be confirmed. Yeah, okay, and bones these bone collections are not well curated because of lack of training. There's not enough space to keep the bones, and of course, the interest in to keep those bones properly is probably not there. Yeah. Now, the impact of having no skeletal collection is that there will be gaps and deficiencies in basic osteological standards. Yeah. I'm talking about the determination of sex, age at death, ancestry, and stature, causing us to rely heavily on standards from other populations. As you well know, a lot of these biological profiles is population specific. Yeah? Relying on standards from other populations can lead to poor results. Yeah, when applied to a very heterogeneous Malaysian population. We are a country with multiple ethnic groups, and then without having a standard of our own, it will be very difficult to to do a proper assessment on the biological profile. Yeah, the situation is more complex. Yeah, when there is always an ongoing mixture among the groups, the intermarriage. Yeah, and then people coming in from other countries. Yeah, so it's becoming more and more heterogeneous. The lack of a skeletal collection also hinders the advancement of research and writing of scholarly articles. The advantage of having a skeletal collection is it can be used as training material for students and medical legal officers. Yeah, and for those countries that are like us currently without reference samples, it can be applied, yeah, but albeit cautiously for to those populations as well, yeah. So again, I can't stress often enough, regional standards are needed not just for determination of the biological profile, but it's also needed for estimation of post-mortem interval. Yeah, our climate is different from the West. Yeah, so we have to again establish standards to determine the post-mortem interval based on our climate, our temperatures and climate. Uh, Here in the region, Japan and Thailand are among the countries that have a good skeletal reference collection. Yeah, uh, universities like University of Chiang Mai in Thailand, University of Khon Kaen, as well as the universities in Kyoto and Tokyo, uh, they have hundreds of well-documented skeletons. Yeah, those with known sex, age, yeah, even cause of death. Yeah, if you're interested, you can refer to the paper by Matthew Go et al. In 2019, where he has a list of the universities and institutions in Asia with a reasonable, very good skeletal collection. Yeah. Now, the another challenge that we have is our national missing persons database. We do have it, yeah, but it's only for fingerprints and DNA. That means if a person still has fingerprints, it can be matched with the registry, yeah, or if the missing person is still able to retrieve DNA, it can be matched with the relatives' next of kin's DNA for a match, yeah. But this missing persons database does not have an advanced search. That means if we have odontology on skeletal remains, if we have odontology input or anthropological input, it is not able to match it to a missing person. Yeah. And to be very effective, I believe a national missing persons database should also include a database of human remains that remains unidentified. Yeah, so there is always ongoing matching occurring in order to identify a missing person. And seeing as how the discipline is virtually absent in this country, there is no graduate training programs. Yeah, if you look at the Americas and Europe, yeah, due to good training programs and facilities, you see that the discipline is well developed in those countries. Yeah, and we get a lot of prominent forensic anthropologists coming from both sides of the Atlantic. Yeah, in this area, historically, Japan and South Korea are among the countries in the forefront of anthropological studies in Asia. Yeah, the respective societies in Japan, which is the Anthropological Society of Nippon and the Korean Association of Physical Anthropology in Korea, they promote the discipline via research and via publication of various journals. Yeah? Having said that, so our local anthropologists rely on overseas training, which is not such a bad idea currently. Yeah, but in the end, I hope to see in the future. I hope to see something local postgraduate curriculum set up in this country as well. Yeah, so because there is no governing, there is no training, there is no certification certifying body, there is no national standardization of procedures, there's no common protocol. Like I said, it varies. Yeah, pathologists might do it differently, anthropologists might do it differently. Yeah, although there is some autonomy accorded to the forensic pathologist or anthropologist depending on the quality of the material available. Yeah, so it depends on it also depends on the state of the human remains that is available for examination. And the other issue is also the rapid development of DNA analysis for individual identification has led to the traditional methods of identification in forensic anthropology being bypassed because of the emergence, of DNA analysis. Yeah, so people might not rely so much on the biological profile anymore. Yeah, so that is why I feel that that is one area of concern. Although there is still a role for the forensic anthropologists in, especially in mass disasters, we're dealing with commingling of remains. Yeah, where the forensic anthropologist has a very important role in segregating. Yeah, the remains by using visual pair matching, articulation, and then when it's segregated in smaller groups, it's easier to apply biological profiling and also DNA analysis. Yeah. Now, and finally, being in public service, we do spend a lot of time with our core business, which is forensic pathology. Yeah, which leaves us with very little time to do independent research. Yeah, so the more forensic anthropologists that we have, the more that we can dedicate our time to pure forensic anthropological work. Yeah. Now, my hope for the future is that, like as mentioned just now, to be able to establish, yeah, that the country be able to establish its own graduate or postgraduate training programs, starting off as a foundational basis in physical or biological anthropology and graduating later on to do a master's or PhD in forensic anthropology. Yeah. Um, so the development of foundational skills can be done locally. And what it would make more attractive is that universities provide posts in for forensic anthropologists in medical colleges, so that and for postgraduate programs, yeah, in order to not just teach, but it will also bolster interest in the field, yeah, leading to more applicants and trainees in the discipline. We are also, yeah, uh, in the process of establishing our own National Institute of Forensic Medicine. We do have one currently based in the hospital, Hospital Kuala Lumpur, but we have our own separate building uh, built in the capital, which is not far from the hospital, which will house all subspecialties of forensic pathology under one roof. Yeah, so we will have a forensic anthropology laboratory within the structures of the building itself. So this provides an avenue for more advanced training, research and development with the budget hopefully that comes with it, with the hope that it increases the profile, visibility, and access of all specialties of forensic pathology, including forensic anthropology as well. Hopefully, again, it will promote interest, yeah, for people to take up this discipline. And I hope to see more collaboration with other established centers. We do have one with the Argentinian forensic anthropology team. They send members of their team to conduct workshops almost every year. So, and then as I mentioned just now, the two, we also have, we do cooperate, we do work together with the Malaysian Armed Forces, who in turn works together with, example given just now was the repatriation exercise for the Australian and New Zealand war dead. Yeah, so we hope by cooperating and providing excellent service, it makes the discipline more visible. Yeah, it will force law enforcement and the general forensic community to take more notice of the field of forensic anthropology. Yeah, and in the future, when a lab, yeah, a competent lab and full-fledged forensic anthropology curriculum is set up, it will again help the discipline to become known to coroners and law enforcement agencies. I can't stress this enough. Yeah, a skeletal reference collection is so important. It enables more research to be done. Yeah, and it enables standard databases and procedures to be developed based on our own population. Yeah, there is research done, but it's currently done in this country based on post-mortem CT images. Yeah, so the very few papers that is published, a lot of them are done on radiographic images, yeah, in this case, post-mortem CT. And looking further forward, it's probably a long time, it will be probably a long time before we get to this stage, but the establishment of a certifying body for professionals in forensic anthropology, along the lines of the American Board of Forensic Anthropology, the Anthropological Society of Europe, the British Association for Forensic Anthropology, and the Latin American Association for Forensic Anthropology. Yeah, these bodies will provide programs of certification in forensic anthropology, will promote adherence to high standards of practice to maintain competence, education, and training for the forensic anthropologists, will provide standard guidelines that can then be harmonized for all forensic anthropologists to follow, yeah, and can give accreditation to laboratories, yeah, as to their protocols and their sample taking and etc. So I believe this is my last slide. Yes, these are the references. Uh, again, thank you very much. Yeah. Again, I'd like to thank the organizers for inviting me, and the questions will be fielded on the day of the Congress itself. Thank you very much.
Ladies and gentlemen, next I am going to introduce you our second speaker, Dr. Khairul Adli bin Nikman, or Dr. Adli, as he is preferred to be called, is currently the head of Forensic Laboratory Department of Forensic Medicine, Hospital Sungai Buloh. He is also the former head of profession for Forensic Science Officer under the Ministry of Health, Malaysia. Due to his vast working experience, Dr. Adli has been appointed as a member of several technical committees overseeing laboratory accreditations across the country. One of the highlights of his work is developing and optimizing the method for alcohol analysis in clinical and postmortem samples by using the headspace technique, which he did during the methanol poisoning outbreaks in the country back in 2013 and 2018. Dr. Adli is also active in writing both scholarly and non-scholarly articles. He has published a book and several articles to date, and with the latest is methanol poisoning outbreaks case series, an article which has been recently published by Forensic Science International Journal in January this year. Without further ado, let us invite Dr. Adli to deliver his talk titled Result of Toxicology Analysis, Interpret It Wisely. Thank you.
Assalamualaikum and good morning. Hi, my name is Khairul Adli bin Nikman. Today, I would like to share some information and experiences on interpretation of toxicology result. My talk will be focusing on the analysis of alcohol in postmortem samples. This is the content of today's talk. I divide it into four sections. The first one is the introduction to toxicology analysis and the interpretation of the result. Second is the factors involved in interpretation. Third, the other consideration to be taken into account. And lastly, the discussion and conclusion. When death occurred and police brought the body to the mortuary, they will issue a Police 61 or P61 order so that an autopsy could be conducted by the government medical officer. Their main interest is to get the professional input as to investigate the death further or to conclude their findings in the field or at the crime scene. And the autopsy or postmortem is a systematic medical examination that includes external and internal examination of the body and usually involve laboratory investigation. The purpose of an autopsy is to give answers to the question that arise due to the death, and the most important is to find the cause of death of the deceased. And one of the concerns of the medical officer or the forensic pathologist is to get the correlation between the death and the presence of toxic. That could be the reason behind the death. That is why postmortem samples are needed to be collected during postmortem and be sent for toxicological analysis, as well as for the histopathological and biochemistry tests. Therefore, the toxicology analysis starts from the sampling process. To proceed with, the sample collected will need to be sent to the forensic toxicology laboratory. Then the forensic scientist will perform the suitability test onto the sample and produce the result of analysis. So, what is forensic postmortem? What is postmortem forensic toxicology analysis is all about? Forensic toxicology is one of the disciplines in forensic science. Actually, it applies the process of analysis of toxic substances, including drugs, poison, explosive, and others in the concern of medical legal. The analysis will produce toxicology results that provide information on the presence or absence of the compounds of interest. The information need to be interpreted correctly and thoroughly as to make it reliable and valuable in the investigation. There are a number of factors that give strength and sometimes might be the limitation of the toxicology finding. Of course, this could affect the interpretation, especially when the subject to be concerned is the postmortem samples. I'm sure that the factors are more, but I can list down a few. There are sample selection, method of analysis, advancement in separation and detection technology, a variation in analytical competence, and data and interpretation. There are some issues that need to be taken into consideration too. They are the conditions of the disease surrounding death, the postmortem changes, the decomposition and microbial activity. These are the issues that usually need to be tackled by forensic pathologists. However, when these issues are overcome, it will help with the interpretation part. Currently, the modern forensic toxicology has been very progressive in all parts of its practice. The advancement in technology and the application in forensic analysis open more opportunities to detect, identify, and determine more substances in a different way and in various matrices. The development in automation in recent technologies has improved analytical methods, allowing for testing beyond the matrices of blood and urine. One of the most extraordinary improvements is the transformation from the use of high-performance liquid chromatography or HPLC into gas chromatography with mass spectrometry technology or GCMS to multi-stage or tandem repeat liquid chromatography with mass spectrometry technologies or LC-MS-MS. Since the 19 since 1980, ECMS technology has been a priceless tool in the forensic toxicology practice. The technology offers the ability to separate and identify any compound in large samples using the same equipment and a similar analytical approach, making it both time-saving and effective. Therefore, It has been considered as the gold standard for substance identification due to its ability to conduct a specific test in order to identify a specific substance or analyte of interest in any given sample. Regardless of the effectiveness of this great analytical instrument, it is hard to deny a notable transition from the use of GCMS into the technology of LCMS and LCMS-MS. The application of LCMS is basically quite similar to GCMS. The only difference is the mobile phase is not an inert gas, but a liquid solvent or a solubilized compound that pass through the stationary phase or a column. The technology of LCMS has demonstrated a very effective detection of low traces of drugs in the bloodstream in a short period of time. The advancement in the technology gives the opportunity to include the use of the tandem repeat mass spectrometer into the LCMS-MS technologies. The tandem repeat instrumentation can detect, identify, and confirm hundreds of drugs in one run of analysis with improvement in their sensitivity and specificity. Now, I would like to go a bit deeper into the factors that affect the toxicology analysis. The first one is the samples and sampling process. I think this is the most important part for the forensic toxicology analysis. Let's look at the first part, this part by focusing with alcohol. By assuming alcohol, whether ethanol or methanol involved at the antemortem stage or prior death, postmortem samples need to be collected. A few selection of samples can be collected, which is common when handling with postmortem sample. The sample can be of blood, urine, or vitreous humor, or a combination of them. Whole blood is the most common sample used in analyzing the presence of alcohol. However, the specimen to be collected might vary and depending on the case basis. There is a code that is widely used in the world of analytical chemistry, which is the result of an analysis is only as good as the sample received. And I still remember another famous quote among the forensic police team, and I once heard from Dr. Yu, a former assistant commissioner of police and the president of Forensic Science Society of Malaysia, saying, "Rubbish in, rubbish out." Both quotes could be best used to explain the importance of sampling during postmortem examination to produce accurate and reliable result of an analysis. There are guidelines that have been published for collecting the postmortem blood sample, and in the case of ethanol, the blood sample should be taken from the femoral vein. Some pathologists prefer to collect central blood from heart, carotid artery, or jugular vein. In some situations, blood sample were just collected using scope from chest cavity when the body was open, and that is the worst possible sample that will be sent for toxicology analysis. Please be sure that the blood sample should be stored in a tube or a container with 1 to 2% of potassium fluoride as a preservative, or you can just use a grey cap vacuum in a tube. Other than blood, urine and vitreous humor are two relevant samples that can be taken for alcohol concentration. In most cases of early decomposition, or whether the postmortem distribution is suspected to take place, if the eye is still intact and protected, it is recommended to collect the vitreous humor along with the blood. The liver and bile can also be collected for toxicology analysis when the substance of interest is concerning drugs. This is an addition to the previous slide where I took from an article of Professor Dr. Olaf Drama, the past president of the International Association of Forensic Toxicologists, or TAIEF, regarding the common specimen that usually collected at postmortem examination. Again, for the transportation and storage of the sample, we use grey cap vacuum tube. The tube contains approximately 1 to 2% weight per volume of sodium fluoride as preservative. The fluoride ion in the tube functions as an enzyme inhibitor, which could prevent any additional ethanol production by the microbes due to their activities. And if the dispatch and transport time to the laboratory for analysis is delayed due to a certain factor, the sample should be stored in a controlled environment temperature preferably at 4 degrees Celsius. Or if the samples need to be kept for a long period of time, you could freeze them. Please do not keep the sample outdoor. The value of the evidence will gradually degrade as the time passes. However, sometimes labs do not prefer to receive a frozen samples. This is because they need more time to thaw the sample before they could begin with the analysis. Now we move to another factor, the postmortem redistribution. To discuss the postmortem redistribution, I need to touch a bit on the distribution of drugs after consumption. In this case, it is alcohol. In an alcoholic beverage, the active ingredient is the ethanol. Methanol, if present, is the toxic contaminant. When the person drank alcohol, the drink goes to the gut, and from there, ethanol will be absorbed into the portal vein. Then the drug is transported through the liver and then into the heart. The distribution will take place throughout all the body fluids and tissues as long as water present. At the end, the ethanol reaches to the various organs and tissue, and the ethanol concentration is at equilibrium. By referring to this condition, we could just simply take any body fluids or tissues that contain water for the determination of alcohol concentration in the body. However, things are not as simple as that when it comes to postmortem sample. After death occurs, postmortem redistribution takes place. It is a process of redistribution of concentration of drug from organ, tissues, and body fluid. There are some important elements that need to be taken into account, which is in drugs cases that the lipophilicity, pKa value, and the distribution of drugs volume previously. The distribution of drugs in the body depends on their lipophilicity and protein binding. Low plasma binding or high tissue binding or high lipophilicity usually mean as extensive tissue distribution. pKa value is a way to indicate the strength of an acid, which is the negative log of the acid of a constant or Ka value. A lower pKa indicates a strong acid. Ionization of drug is so much related to the pKa value. If the value of pKa is equal to the pH, the drug is ionized at the half. Ionization of drug can affect the rate of distribution as the drug permeates the membrane barrier. It is believed that the mechanism of the postmortem redistribution can be described as this: the accumulation of drugs in tissues. The drug diffuses to the nearby blood vessels and lost the equilibrium. The movement of blood, the effect of pressure and changes in the fluidity can be a factor to redistribute the drug concentration to other sites. The putrefaction or decomposition. In this stage, most of the cells suffer autolysis or begin to lyse. The lyse of the cell change the drug concentration. The other factors involved in the interpretation is the analytical method. The method of choice is for alcohol analysis is by using gas chromatography with mass spectrometer or a flame ionization detector. The separation of the compound will take place in the gas chromatography, and the separated compound will be detected in the detector, whether in MS or FID. The suitable injection method is by using the headspace sampling technique. The advantage of the headspace sampling technique compared with the direct injection is that it is a clean operation. It's only inject the evaporated vapor of gas from the incubated specimen into the column. Therefore, it could protect the column from non-volatile samples metric constituent. A little bit on the separation. A separation is a condition where the column is able to separate various volatile compounds. This is due to the nature of the column, its selectivity, and also the specificity. Usually, it is the manipulation between the polar and non-polar constituent. The capillary column is called the stationary phase, where the injected compound interacts with the differences between the polarity of the compound and the capillary wall. The helium gas that passing through into the column is also called mobile phase. As helium is an inert gas, it does not interact with the questioned and interested compound that make their way through the stationary phase. The interaction between the polarity of the compound and the column wall induces separation. If the compound interacts fast, it elutes fast. A slow interaction will elute the compound slower to the detector. To compare FID with MS should be done in another chapter of discussion. However, in some famous but older articles, they claim that the DC with FID is the gold standard in the determination of alcohol in concentration. The FID is able to measure the current signal of the burning compound in a flame. But in a recent trend, researchers moved towards mass spectrometer as it could give the exact measurement of the concentration and its intensity of the compound of interest using the ion fragment that produced during the hard ionization. And as for the international standard, there are a selection of N-propanol, T-butanol, and isopropanol. And it is suggested to choose T-butanol as both N-propanol and isopropanol could also present on the composition stage other than acetone and can be the interference substances. When the peak of compounds emerge on the chromatogram, it does not mean much until the peak is assessed. Try to look into the probability of the said compound at the specific retention time. If the probability is high enough, say 80% and above, then it might be the correct compound. The next step to reconfirm is to quantitate the concentration of the compound by comparing with the known amount of a series of ethanol or methanol standards. If the concentration is less than 30 mg per deciliter, the compound might not be a concrete evidence to point out as an antemortem consumption of alcohol. A concentration of ethanol that less than 10 mg per deciliter could be ignored and reported as not detected. Why? This is because a normal limit of detection or the limit of quantitation or LOD or LOQ is stated at 10 mg per deciliter or less. It could suggest a contamination by diffusion from redistribution or contamination from the microbial activities and the stage of decomposition. However, if it involves methanol, another round of analysis is needed to reconfirm the presence or absence of methanol. Methanol is not a product of postmortem production and might be an indication of contamination in ingested alcohol at the antemortem stage. It is advisable to take more than one type of sample in order to get a full picture of the antemortem consumption and to rule out product of postmortem production. Also, the best is to have a complete history from the relative and friends about the trends of alcohol intake of the deceased. There is another consideration that needs to be looked upon, the level of doses of the drugs. In this case, the ethanol. I like to give an example. A victim is sent to an emergency department with symptoms of hyperventilation, drowsiness, abdominal pain with nausea and vomiting. The arterial pH is below than 7.3. The serum bicarb is less than 20 millimole per liter and osmolar gap is more than 10 milliosmol per liter. The patient did not admit to having an illicit alcohol ingestion within 5 days prior admission. The victim was suspected to have had consumed methanol-contaminated alcoholic beverage and was at risk of methanol poisoning. One of the treatment is to flush out the methanol by infusion of ethanol via IV or per oral. Unfortunately, no sample of blood were taken before admission. The blood sample was only collected after the first infusion of ethanol with the loading dose of 10 mg per kilogram or 10% ethanol over 20 to 60 minutes. The sample was sent to the forensic laboratory and the treatment is continued. Unfortunately, the victim died the day after. Then the body was sent to the mortuary for a postmortem examination, and during the postmortem examination, a set of blood and urine samples were collected and sent to the forensic lab. The first sample collected are marked with A1 and the second one is A2 and urine. And this is the result. We could see that none of the specimen detected with methanol. Was that mean he was not suffering from methanol poisoning? But The only thing is the health facility failed to collect the most valuable evidence, which is the blood sample before treatment. Then the results showed that the concentration of the ethanol was detected high in every specimen. The concentration of ethanol was actually from the therapeutic doses that were applied to the patient before his death. Could we perform a back calculation to actually measure the alcohol he took before his admission? Did he really die of ethanol poisoning or of ethanol poisoning? This is what we can do to equip ourselves with some knowledge on toxicology analysis. The use of general information. We could always refer to the published postmortem research data related to the concentration of ethanol present in postmortem sample. There are lots of descriptive data with huge amount of drugs, including the concentration of ethanol in postmortem sample. By practicing a literature review once a while, we could also review the therapeutic level of drugs and substances other than their toxic and lethal doses. And at the same time, we could polish our knowledge on the type of non-toxic and toxic drugs that are usually found in postmortem sample. And as to summarize everything, during the process of interpretation, there are matters that should be taken into account. The first one, type of death. Was the deceased a victim of suicide, homicide, accident, or was it a natural death? Then the interval time between the death took place and the collection of the sample during postmortem examination. Was it too long? How long? Could the postmortem redistribution take place already? Or was the process of putrefaction or decomposition have already begun? And during the sampling, what site did the specimen collected? What type of specimen that is needed for your investigation? And what kind of substances that might be present? Is it drug, alcohol, poison? Do you expect to see any therapeutic drug from the sample? Or is the drugs present at the specimen are the therapeutic drugs? And as for a conclusion, the toxicological analysis is an important part in the investigation of unnatural sudden death, suicide and accidents where the substance of abuse or alcohol intoxication is suspected to involve. With the recent technology, the method for qualitative and quantitative analysis of ethanol and methanol in body fluids are the same, regardless of whether specimens are taken from the living patient or a deceased. The presence or absence of ethanol can be determined with high degree of accuracy, precision, specificity, and selectivity using a space sampling technique accompanied with the gas chromatography mass spectrometer to deliver an indisputable identification of the substance of interest. Substances such as ethanol, methanol, acetone, and 2-propanol or isopropanol distribute evenly throughout the body according to the water content of organ, fluids, and tissue. The phenomenon of postmortem redistribution, decomposition, and microbial activities could result in a different concentration of alcohol in the postmortem blood compared with the concentration present at the time of death. And the high concentration of ethanol might be a sign of the therapeutic level in certain cases, such as in methanol poisoning. The interpretation of person blood alcohol concentration should cover everything, from the information about the toxicology results, the interviews with the witness and the police. A famous yet recurring question is, how sure are you that the internal concentration of the postmortem sample was due to the antemortem consumption instead of the postmortem production? That is why the interpretation is needed to be done wisely. And I think that is all. Thank you for your time. Assalamualaikum warahmatullahi wabarakatuh.
Ladies and gentlemen, next I am going to introduce you our third and last speaker for this symposium, Madam Nur Aidora binti Saedon. Madam Aidora is the Director of Forensic DNA Division, Department of Chemistry, Malaysia. She is essentially a forensic DNA analyst with almost 23 years of experience. Because of her immense knowledge and experience, she has been appointed as a trainer for several organizations such as Polis Diraja Malaysia and also forensic organizations in the neighboring countries such as Thailand, Brunei, Philippines and Vietnam. Madam Aidora is quite a familiar face in court as she is an expert witness when it comes to the DNA evidence. With that, let us invite Madam Aidora to deliver her talk titled Forensic DNA Analysis, Challenges and the Way Forward. Thank you.
I'm going to start my talk in forensic DNA analysis, challenges and way forward. So I'm sure you're familiar that I'm from the Department of Chemistry known as QnA Malaysia. And this is where our building is. So it's in PJ. So basically for Department of Chemistry Malaysia, DNA Forensic Division, we carry out analysis on evidentiary biological samples, basically all the samples that's pertaining to murder, rape, assault, body identification, paternity cases. And because we're at the moment, we're the only forensic laboratory that doing DNA analysis, and even hospitals are not doing DNA analysis. We do provide paternity and kinship testing services for government agencies, private sectors, as well as individuals. So any Tom, Dick and Harry are most welcome to come and give us evidence for us to test if you need to do DNA analysis. So this is the where QnA Malaysia is located, and the one that is colored in yellow are those having DNA analysis facilities. So basically, we are not able to provide all the facility of QnA Malaysia to have forensic DNA service because it's very costly. The DNA analysis for one sample costs RM 800 ringgit. So it's actually very costly. So therefore, that's why as much as we can, we try to limit the samples sent by the police department. However, of course, we always say that there's no cost to justice. So we have one in Penang to cover the northern region. We have, of course, Petaling Jaya HQ where I'm located. So we actually oversees the rest of the country for DNA facilities. But then again, we only receive cases that non-northern branch. And then, of course, Johor will take over for the southern region. We have Kuching taking care of Sarawak, Kota Kinabalu taking care of Sabah. And we are opening Terengganu, most probably will receive their first case in probably the second quarter of this year. And we hope that slowly the Kelantan and Terengganu DNA cases can be received by Terengganu branch. So I believe that is also a good news for the pathologists. So for the people in Hospital University Science Malaysia, Hospital Kelantan, Terengganu, you are able to send unknowns or even bone specimens to Terengganu for DNA analysis. Since these are some of the types of samples that we receive, we've got blood stains, semen stains, of course. This is, I would say, the nicer versions of the samples I receive. technical disruptions. I'm not sure what actually happened. So basically, for DNA Forensic Division, we carry out analysis of evidentiary biological samples. I think, in short, we receive basically murder, rape cases, anything to do with body with biological fluid. And in fact, now even the Department of Jabatan Alam Sekitar, they still they are trying to send samples. If let's say they were to find what you call that, some blood specimens that is nothing to do with even criminal cases, they will also send to DNA analysis. So apart from the normal cases that you know, murder, rape, we also receive cases involving narcotics trafficking, and of course all these petty crimes, to ensure that the actual perpetrator are caught. And since we are the only DNA laboratory, we also open up our services to private sectors, individuals that needs to do DNA analysis. So for the next slide would be the forensic DNA services in Malaysia. So those are the locations of where QnA Malaysia is situated. However, those in yellow are Penang, Terengganu, Petaling Jaya, Kuching, Johor, Kota Kinabalu are those having DNA services or DNA facilities. And Terengganu will start opening in second quarter of this year. So basically, why we are unable to have all QnA Malaysia having DNA services, because it's very costly. For one sample, it costs us RM 800. And that is why we are always haggling with the police, asking, why are you sending so many samples when the identity of the unknown body is already ascertained. And I know that sometimes this is quite prove a bit of difficulty for the pathologists or the medical practitioners. But then again, we don't understand once the body has been identified, why you still need to send for DNA analysis. And sometimes the police themselves doesn't know why they have to send to us. So that's why, because of the cost mainly, and we feel that this is all taxpayers' money, right? So these are some of the samples that we receive. Of course, I would consider these all are clean samples. We practically receive everything under the sun. We have received semen block, as just because they've got blood splatter, and yeah, we've got even a whole mattress sent to us. And talking about some of the samples, it would be good for the for rape cases if the medical practitioners found out that the victims has what you call that love bites, or molestation through that means no penetration. It will still be good for DNA as long as the area has not been washed off by the victim. So I will always recommend that even for molestation cases, you still can get DNA analysis. You just need to swab the area of the love bite, or the area of what you call that, where the lady has been groped. So then hopefully we probably get a good DNA profile to catch the perpetrator. All right, so this is the DNA procedures that we do it every time. So a crime occurs, or even not a crime, any cases, and of course we need to have investigation officers, or even hospital, you call that personnel. And of course, the sampling can occur at the crime scene or at the hospital. And then you send over to QnA Malaysia. First and foremost, we need to register the case and the exhibits. And this is where we will check the, the POL 31 or your request form to see whether what you wanted and what the exhibits are tallies. You see, because this is very important to have this checked thoroughly, because this is what is going to be asked when you go to court. So going to court is a different ballgame altogether. That's why we need to be careful from beginning to know that the request and the samples tallies. And of course, for us here, we have to do physical examination. If they are talking about the mattress, how large is the mattress, how thick is the mattress, the color of the mattress, everything will be recorded. And then of course, we have to do the screening of the biological evidence. Let's say, for example, you're looking for blood, then you're looking for Castle-Mayer test. If you are looking for semen, there is going to be AP test. I know that the police are using the polylite but then again, the polylite is not as accurate. And doing AP test is really a toll on the officers, because you need to cover every area of the exhibits that has been given. And then of course, once we have located the biological evidence, then we have to sample for DNA analysis. But then again, that is, you're talking about biological evidence of semen and blood. But if you're talking about trace evidence, which means that you want to see whether there's any contact, that comes under trace evidence, and that has to be swab or cut. And then again, that is why we need to know the nature of the case before we can actually know what we're looking for. So let's say, for example, you're talking about a case that involves shooting a person, and there is no contact whatsoever. So if the police ask for trace evidence, definitely they are not going to get. That's why we usually our officers will ask lots and lots of questions of how does it occur, what is the case is all about, and what needs to be done. And when we have done the analysis for you, what do you want to do with the results? How best that the results can actually assist you in determining the perpetrator, or how the case actually happened, or how the mugging or the rape or the murder actually happens. So that is important, because we do not want that having to spend so much money, and at the end of the day, our report or our analysis or our evidence, our findings are not being used for determining the outcome of a case. Then of course, after sampling, we have to do DNA extraction. So DNA extraction is huge. You know, you're talking of different extractions for different types of samples. Of course, the easiest would be blood specimen on FDA card. So that is quite direct. But others are talking about semen. You know, you have to do differential analysis, which until now you can ask all over the world. There is no differential analysis that is fully automated till now. And you can ask people in the States, you can ask people in wherever, you know, talking about DNA analysis for differential. No such thing as having it fully automated, which means that it's labor intensive. And differential analysis is mainly used for rape cases, and you know how many rape cases that we have in Malaysia every day. All right. And of course, you're talking about bone. Getting DNA out of bone is also another different ball game. You know, you need to clean the bone to ensure that the bone is really thoroughly clean. At the same time, cleaning the bone thoroughly, but you do not want to jeopardize the bone, that you actually throw out some of the DNA that you need, because the DNA of the bone is so little. Then of course, DNA extraction will couple with DNA quantification. When you're talking about DNA quantification, is to know how much of DNA is there. And this is a very important step, because you need to know whether is there DNA. You know, you kind of, it's like a, what you call that, and guarantees to you whether you get your profile or not. Because if there's no DNA for during quantification, that means you're not going to get any DNA at all, right? Or there's no profile. Now, of course, you do DNA amplification, and in 2000, the DNA amplification is only at 9 loci. And of course, after that, after 2003, you have 13 loci. And then 2016, you have 16 loci. And of course, as of now, we are looking at 24 loci. So why are we talking about so many loci? So the more loci you have, the more identification of the perpetrator is high, you see. So that's why you see lots of people, lots of companies talking about more and more loci. But then again, you need to have a stop to it. How much more you want to go? At 24 loci, your for that random match probability can reach up to the 10 to the power of 38 or 40. So even the population of the individual in the world does not reach 10 to the power of 40. So therefore, I believe that strongly, at 21 or 24 loci is enough, and you need not go further, all right, for identification. And then, of course, electrophoresis for us to get the profile out. Last but not least, you do have to do DNA analysis, interpretation, and of course, report writing. And you notice the loop, if let's say we couldn't get any data, then we need to start again, right from extraction. And that's why sometimes, the police, even the law enforcement are asking, why is it that your report is not ready? And this is it, because it's something that you can't see. So therefore, you just have to follow the QA and to follow the steps and hope that everything will be fine first time, but usually it's not the case, right? So I believe that we have a symbiotic relationship with the pathologists and the doctors, the PDRMs, especially the crime scene investigators, the investigating officers. And this is very important because QnA Malaysia or DNA analyst does not do sampling. We rely, I would say, 99% on the CSIs, on the pathologists, the doctors, as well as the IOs, all right? The 1% is only when there is what you call public interest cases, or cases where the medical practice feels that it's good to have us on board to assist. Then yes, we will of course assist the medical practitioners and as well as the CSI. But like I said, 99% the sampling is taken by non-DNA analysts. And last but not least, once you've got everything ready, then the DPPs and the lawyers will come into court and play. And of course, we have to have a symbiotic relationship with them as well, because you need to know how best that your analysis can help, not only the deputy public prosecutors, but as well as the lawyers, because I believe that when we do any analysis, we are impartial. We serve the people. And if, let's say, the findings actually backs up the DPP's, thinking, then that person is the perpetrator, so be it, Or if, let's say, that we couldn't find anything and the lawyers uses our results as their advantage, also, it's fine, you see. So I believe this is something that is important for us to ensure that justice is served all the time. Of course, the challenges. As a DNA forensic analyst, there are lots of challenges, especially looking about the nature of the samples received. We can't pick and choose samples, The forensic samples are mostly degraded, some are charred, exposed, And Malaysia is a tropical country where high humidity, high temperature, and of course you have lots and lots of rain. Sometimes it's very difficult to explain why we couldn't get a DNA profile. Because people will start comparing with TV shows, saying that, hey, they are able to get results and the blood has been there for a month and they are still able to get DNA. And how come, you are not able to get? It is not as easy as that. DNA is a biological evidence. It's like you go to market and you get yourself a chicken or a fish. You still need to store it. I'm sure that if you go to market in the morning, by midday, you probably smell something. When you smell something, that means degradation is occurring, which means that your DNA is getting degraded, which means that you're probably not going to get any good DNA out of it, you see. So that is in your house, which means that it's it occurs. So what more if you're talking about forensic cases that is outside, where you have direct sunlight, and of course, again, we call that dirty environment. So therefore, that creates lots of bacteria. Again, enhance the degradation as well as compromising the samples. Having said that, a lot of people, a lot of CSIs were saying that in a lot of murder cases where you see a pool of blood, and they quickly run to the pool of blood to swap the pool of blood. And for me, there's always a no. Look for samples that are not in a pool of blood. Why? Because when you're talking about a pool of blood, that means degradation is occurring because there's the biological evidence is not dried yet. So always look for dried samples, dried blood stains, and that would actually give you more higher chance of getting a good DNA profile compared to a pool of blood. Okay, so nature of samples, duration to sampling. So usually what happens, there's a few cases where it starts off as sudden death report. So if you're talking about sudden death report, usually the sampling were not taken thoroughly, or maybe they didn't even take any samples. And then after a week or two or even a month, it becomes a criminal case. And then they decided to, okay, let's go and pick up the samples after a month or after a week. It doesn't work that way, you see. So duration of sampling is very, very important. One, not only because of degradation, but of course, contamination. People have gone through it. People might of course, there's other people that are not, involved in the case might have actually turned up there, and that would of course contaminate the results. Okay, storage issues. For DNA analysis, we always please, when during our dialogues with the medical practitioners, please don't have any preservatives. We don't want any preservatives. Once you swab it, just dry it and keep it and send to us. Even for vaginal fluid, low vagina, high vagina, your rectal swabs or whatever not of swabs, we don't want it to be in preservatives, because the preservatives actually hinders our DNA analysis. Therefore, we couldn't get a profile. And of course, talking about prior to QnA, which is prior to my lab, sometimes the case are taken, let's say a week ago, and no proper storage. You don't put it in the freezer. And worst scenario, you put it in the car and you leave the car in the hot sunlight. And that definitely doesn't help, And talking about storage is not only prior to QnA, after the analysis, as you know, DNA is progressing. And certain cases, you are able to open back, what you call cold cases. Let's say cases that happened long time ago, where DNA analysis has not been heard of. And this can be kept in a proper storage. Therefore, it can be reanalyzed as better and newer techniques have emerged. And acceptance by international laboratories is also a challenge. You need to have accreditation that is accepted by the forensic community internationally, which allows your report or your results to be taken as a whole. When I say taken as a whole, means that your profile is accepted. So what happens if you don't have accreditation? If you don't have accreditation, they want the actual sample, and they will do the profiling, and then they will compare with their results. So accreditation is also a big issue. And last but not least, DNA analysis techniques itself. We have to interpret the data. It doesn't come interpreted. It doesn't come in a report. So sometimes dealing with gang rape cases, or basically cases that has mixtures of more than 2 or 3 individuals, it is a laborious task for us to interpret and to ensure that the perpetrator is actually the perpetrator, or maybe it could be somebody else, you see. And Talking about nature of samples, all right, we are talking about the sample types, you know, whether preferably skull or sternum or femur. Of course, a medical practitioner prefers sternums, but then again, in a lot of cases, especially charred or degraded, we always opted for femur. Okay, degraded samples, charred body. Of course, you're talking about dangerous samples, you know, such as chemical weapon. The case examples are as below. Of course, these are some of the samples that we receive. If you're looking at the top right, those are actually actual cases of samples of Dato' Susilawati case. And then some of the pictures are also from MH17 cases. So this is a toddler found dead in Langkawi where she was thrown off a ravine. We only, the police were only able to find some skull, a bit of the skull. How many minutes? Okay. All right. And then we have lots of hairs, but of course no hair roots. Therefore, bloodstains were found on the computer. Alright. So this is the Dato' Susilawati. Like I said, you know, the sample itself, we aren't able to get what you call that DNA out of it. And this is Anapuri Jenkins again. Compromise. This is the chemical weapon. I didn't know that the clothing examined had the VX nerve agent. Like I said, the sample itself is also a challenge to us. All right, and then duration prior to sampling. I'm talking about SDR to murder charge. I'm talking about the cases of course, the Kevin Morris, where it has been left long, and then of course because of that. But then again, in this case, we were able to get good DNA profile. And this is Ivana, where the at first start off as SDR and then becomes murder. Stephanie Foray, of course, it has been left in the cave for quite some time, for more than a month before she was found. Storage issue, like I was saying, the method of storage, yeah, no feed. And this is talking about the Khairul's case, where after 8 years, we had to exhume again the bones for DNA analysis. Audrey Melissa, and I'm talking about cold cases, and this happened 20 years ago where DNA is not as advanced. And we are trying to get DNA profile, but of course it's a bit difficult seeing after 20 years, it has been degraded, very, very much degraded and compromised. Again, Nurin Jazlin, also way back, that was 15 years ago. Again, I was talking about importance of financial education, talking about ANAP. Of course, identification not only for MH17, but also for non-Malaysian, which means that if you have any tourists that actually found in Malaysia and they wanted the profiles, and that can be also given once you have application. And in MH17, because we have application and we are accepted internationally, our profiles are being used directly. And talking about interpretation, we have mixtures, you know, talking about uncertain relationship. That's why we need to ensure the relationship of the individuals. It is very difficult when the request was saying that it is the child, when actually the child is adopted. So therefore, it definitely is not going to be a match to the father or the mother, supposedly say biological, right? Incest cases is of course very difficult as well. And talking about interpretation, this is how a profile would looks like if it's a mixture, and you need to ascertain every peak and to see whether it's a peak and which peaks belongs to an individual, or which peaks belongs to perpetrator or victims, or could be just somebody who just left his or her DNA there. Why killed by a falling chair? Because the chair, we found so many or basically a lot of DNA mixtures in the chair, but unfortunately we weren't able to find any match to the perpetrators given. This is trailer crash, burn 4 family members, and because of this, again, close relationship also gives a bit of difficulty for us to interpret. Okay, way forward. Okay, we hope that for compromised samples, we have better DNA techniques. We are looking at phylogeneity, which means that you use the DNA of looking at not only as a whole to compare, but you are looking at the YSTR, REX-XTRs, you are looking at mitochondrial as well, and also look at the DNA bank data to see whether they have any siblings or any close relationship, and therefore we can do investigation through them. Next-gen sequencing is also something that we are looking at. We need to understand how best it can be utilized, but you're looking at next-gen sequencing, the data comes up around 300 worth of data, and of course to look through, to sift through, and to systematically translate the data into understanding an understanding report is different toll altogether. Duration to sampling, we urge that proper sampling needs to be done, first on, in respect. And of course, the police also need to be equipped with proper storage facilities, to ensure that they are able to keep their exhibits at a proper manner, and then when they send over to us, it is still in a pristine condition so that we are able to get profile DNA out of it. Of course, overseas accreditation, training, talking about proficiency testing, SOPs, test methods. We are also looking at the DNA technique that is less destructive, because I believe that, of course, nobody wants their loved ones to be cut off and their bones, to be gone. So as much as they want their loved ones to be intact. So therefore, we are also looking into that. Better crime scene management sampling, of course, improved techniques of sampling, and working closely together with other agencies such as the Royal Malaysian Police and the Ministry of Health. If the law has made you a witness, remain a man of science. You have no victim to avenge, no guilty or innocent person to ruin or save. You must bear testimony within the limit of science. So, as a DNA analyst, we are limited by what is being given to us, and we are only able to give the results of whatever that we have from the samples. And with that, thank you.
Thank you. Ladies and gentlemen, now that we have completed all the 3 presentations by our distinguished speakers, we are now in the Q&A session. Okay, I shall read all the questions posted to us, and then we'll address it to the respective speakers to answer. The first question goes to Dr. Azaini. All right. Dr. Azaini, could you please comment on forensic facial reconstruction? How reliable is this current technology, and its legal admissibility in Malaysia's context?
Thank you, Dr. Razin. Can you hear me?
Yes.
Yes. All right. Now, forensic facial reconstruction, the way we know it, let's say if I were to bring you from the history to what is currently practiced up until probably the late late 90s is we started off with clay, facial reconstruction, and then it moved on to video or photo superimposition. It is and it will remain, as far as I'm concerned, just a method of exclusion. Yeah, it will never take the place of a primary identifier. Yeah, so and with the advent of so sophisticated IT nowadays, yeah, almost everybody has a mobile phone with them at any given point in time. Yeah, a crime can be committed and someone whips out his phone and captures an image of the crime committed. Yeah, if you look at the all the viral videos and photos going around, it's not just photos but even videos. Yeah, people can actually capture and document. Yeah, and we're not even talking about CCTVs, which is placed in most places nowadays. So personally, I think facial reconstruction will probably be used less and less. Yeah, people will just probably rely on videos and images captured by CCTVs and mobile phones and so on. It will never replace primary identifiers anyway. It's just a method of exclusion, yeah, as far as you know. So that I hope that answers the question.
Okay. All right. Thank you, Dr. Azaini. Next question is for Dr. Adli. Okay. In the case of suspected methanol poisoning, all right, which is based on the circumstances and autopsy findings may not be specific for that, and then yet the toxicology results for methanol analysis comes back as negative. So how do you explain that, and how do you suggest that we answer that in court? Thank you.
Thank you, Dr. Razwin. I think in that situation, methanol is something contaminant in ethanol in alcohol samples, alcohol drinks. Okay, so in methanol poisoning, suspected methanol poisoning cases, but the methanol is not detected during the analysis, then we need to look for its metabolites, not only for methanol itself, but also for metabolites. I mean, it's formic acid or formic. So another methods could be applied to test for formic acid. And if formic acid was detected, then it may indicate that the possibility of methanol poisoning that involved in the death, but not that concrete because the methanol is not there, but it can suggest something that maybe this thing is occurred due to methanol. I think I can answer that question.
Okay, thank you, Dr. Adli. Next question is for Puan Aidora. Okay, in some forensic cases, for example, skeletonized human remains, okay, we have obtained the femur samples for DNA, right? And then when we get the results for DNA, it says that no DNA has been able to be extracted. Okay, so how is it that we should go about that? Should we have an extra samples when we do the postmortem? Which is, I think that's not quite a practice here, but how can you help with that?
All right. So what I would suggest is that you have extra samples ready, right? Because the normal practice for cases that, let's say for example, you couldn't get DNA in the first place and your samples has finished. So usually we will ask for more samples. And therefore, but then again, we also need to understand the nature of the sample itself. Let's say, for example, the samples has been degraded. Having lots of DNA is not only important, but it's also crucial for us to see how best we can get a DNA profile. Right?
Yes. Okay. Thank you, Puan Aidora. I think we are going to have one last question here, which is for Dr. Azaini. All right, same with the previous question, which is on the skeletonized human remains. Is it a practice here to take an extra samples for DNA? Because we usually would collect long bones and then we should sample it from the long bones. So do you suggest any other areas which we can take as reserve samples in case the first sample sent to DNA lab came back as no DNA being able to be extracted? Thank you.
I would always prefer to take a bone which is thick. Yeah, to me the best is still the femur. Yeah, it's got thick cortex, and then the chances of DNA yield is better in that sense. Yeah, but again, like what Aidora said, the degree of decomposition is the utmost factor in determining how much that we might finally get. As to the practice of having a second separate spare sample, again it depends on the pathologist. Yeah, and depends on the material at hand. If the material is still considered, I wouldn't say fresh, but the bones are still, I'm talking about bones here, yeah? If the bones are still considered fresh, you know, the color is still there, it's still, the feeling is that the bone is still viable in terms of DNA yield, yeah? A good 4 centimeter, 5 centimeter piece of femoral cortex would probably do the trick, yeah? That is if there is no other marrow. Yeah, I'm talking about bones which has been left for a couple of months. I would not expect to see any more marrow left. Yeah, so try to look for bones which are has a really thick cortex. That would ensure at least on the part of the pathologist that he has taken his best and that hopefully that might yield something. Yeah, I don't know what else can he or she take as a spare if he's already taken femur, but I guess it's worth trying. It depends on the material available and in what condition that material is.
Okay.
I hope that answers.
Yes. Okay, thank you very much, Dr. Azaini. Ladies and gentlemen, with that, I think we can conclude our symposium session. On behalf of the organizing committee, we wish to express our utmost gratitude to our distinguished speakers, Dr. Azaini, Dr. Adli, and Puan Aidora. And to the participants too, thank you very much for your attention and kind participation. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much.
Thank you so much. Have a good day.
Thank you.